Hello, welcome here to Los Angeles. I'm here today at the gIDE Institute. My name is Sascha Jovanovic. It's my pleasure to be here with Professor Sergio Kahn from Rio de Janeiro, Brazil. Sergio, welcome to Los Angeles.
Thank you so much, Sascha. It's my pleasure. Great pleasure.
So Sergio is invited here by the gIDE Institute to give a lot of his work in research and clinical experience on root coverage procedures in perio. And obviously, I'm very curious about many things that he does in his practice in Brazil. So Sergio, first of all, you've been specialized in perio for many years. When did you start your periodontal career?
Well, I've been a dentist for almost 35 years. And I've been periodontist for almost 33 years.
So a long time. Yeah, we're almost the same.
Yeah.
I've been in the perio implant field also like 30 plus years.
I think we have seen many things in field of periodontology.
Yeah.
Along this time.
Yeah. And I know your interest is very much on minimal invasive surgery. Why? What stimulated you and what inspired you to think more about minimal invasive surgery and obviously improving consistency? What was it? What were you seeing in the field?
Yeah. From the last 20 to 30 years, what changed the periodontal surgery? This is one question. We have a lot of changes in time from the 30 to 40s, so now on. But the last 20 to 30 years, we are looking for small flaps, for minimally invasive surgeries, for wound healing, bone healing, for the kind of procedures, because we know very well that success today is related to management of soft tissue. To achieve soft tissue management, the procedures to achieve success need to be very, very careful with the soft tissue. I think this is the best.
Well, I've worked with soft tissue for a long time, and I work with, of course, bigger flaps because of bone regeneration. When I know that the big topic in perio is, of course, like, do I do like a tunneling procedure with or without vertical incisions? And you, I believe, is very much trying not to do a vertical incision. So why do some experts in the field like vertical incisions? Then why do you prefer really to try to do everything as much as possible with no vertical incisions?
Yeah, I think we can achieve the result, the success, with some techniques, with vertical incision or without vertical incision. But in my personal opinion, I prefer not perform vertical incision because I may be in front of scars. Okay, so if I try not to do, if I try to work on minimally invasive procedure, I prefer to use these techniques.
Okay. And then, of course, like there's always the big question about biomaterials and soft tissue grafting. I remember American Academy of Periodontology, AAP, many years ago, brought out a consensus. What is your opinion? Because I know that, the companies are always giving us stuff. They say, try. But we always go back to connective tissue. Is there, what do you do in your practice? Because you have a private practice.
Yeah. When I'm not traveling, I'm in my home private clinic. And we are looking for predictable procedures, predictable materials, predictable techniques. And we know that the total standard for chief root coverage is a connective tissue graft. So if you want to use biomaterial, no problem. I think the question is you need to select the best region, the best clinical case to use the biomaterials.
Okay. So, the same with growth factors. So, like growth factors, of course, we have PLF, we have Emdogain, we have here in the United States, we have like GEM21, which is a platelet-derived growth factors. In Brazil, it's different. I know you have acai in Brazil, but that's not really a growth factor. It's more like a health supplement. What do you use in Brazil? What is your preferred growth factor?
In Brazil, it's different because we don't have the GEM21S, we don't have iodine, hyaluronic acid. We have endogain. So I use also endogain, but as I am a clinician, I know the research. I'm based on the research, so I use also because of this point. Well, I have only this opportunity to use this material in Brazil, so I use endogain.
Okay. Let's talk about sutures, because I know that sutures are also very important for you, and scalpels. I saw in the procedure that you did, you used this very delicate, small, bendable scalpel.
Yeah.
And you used, of course, a lot of small sutures or small needles. Is that important for you, and what do you use?
Yeah. If I'm trying to use small flaps, minimally invasive procedures, it's very important, first of all, to use magnification. That's the first thing. And to achieve the best results. Magnification and also small instruments, small sutures, and microblades. So when you have all of this, you need to follow the learning curve to go. So I use small instruments, I use microblades, not only 1, 2, 3, depends on the procedure, the technique, and small sutures, small needles, 5, 6, 7.
Well,
And needle 7.7 millimeters needle, maybe, and because of the procedure, we are working in soft tissue. We have success, failure, rotation, and nightmare. So we need to avoid complication, failure, and nightmare. So it's very important to use the best as we can to achieve the results.
So, simple question. So, 9 out of 10 of your patients, do you do a vertical incision or no vertical incision?
So,
tunneling. 9 out of 10 patients, do you do tunneling or no tunneling?
I like very much the technique. It's my preference today.
Okay. Growth factors. 9 out of 10 growth factor or no growth factor?
I use biological aids. I use when my assistant don't forget to buy.
Okay. Then give us a little bit about instruments. Like, you work with special instrument companies. Which one?
No, we have all over the world very good brands, very good. So but for a long time, more than 20 years, I use instruments for Helmut Senf and Schwerdt from Germany. So fantastic brand for more than 100 years. Okay, so it's very good. He's a very good plan, but well, I'm very satisfied that this is.
Sutures?
Sutures, I use a lot of sutures. I use from Resorba.
Resumo?
It depends on what I have in Brazil, because I use from Resorba. We have in Brazil, very good. As in you use also. We have fantastic sutures. Also, resourceable, the glycolol. We don't have in Brazil.
Oh.
Not yet. But I'm waiting for this. I use one that UFRJ that have just arrived in Brazil. The brand Camelot one Camelot. And I use one that's from Germany also. Serac. It's very good. Seralene.
Yeah,
You know.
yeah.
Well, I think we have good sutures all over the world. It depends on for what you need and your preference and the procedure.
So basically, sutures is for you like for many of us, it's like a unique tool. Then you don't just buy like a generic material. It's not something that you source specifically for your procedure.
Yes.
That makes sense. Okay. I want to talk a little bit about your book because I know that you're also a very prolific researcher and writer. Tell us a little bit about the book. I received from you a really beautiful gift, which is your second generation. Thank you so much. And it's in English, I believe.
Yeah.
Tell us a little bit more about that.
Well, I had the opportunity to write 3 books. The first one is Gummy Smile. Gummy Smile. The second one was on root coverage, challenging concepts.
Mm-hmm.
And the third one is one mix that is not only for the professionals, but for patients, because it's very difficult to show the patients the procedure. So this third book, it's without bleeding.
Okay.
Okay, if the professional wants to take a look at the procedure, just put the camera at the QR code and we can look at the procedure.
Mm-hmm.
But this second one, that is Lenny's second edition, in English, it's root coverage, challenging concepts.
Yeah. Then I have 3 final questions. One is, why are dentists so afraid to harvest connective tissue from the palate? And how can we help them?
Yes, it's a good question. Very good person. Well, because, of course, the greater artery, they Halatan artery, because of the greater Halatan artery, people are afraid, but I think that we need to understand, we need to study, we need to know the anatomy of the palate. I think this is the key. Well,
And does your book explain the anatomy?
yes,
Okay, so, for the viewers, hopefully, the book will be helpful.
yes.
A second question is, to explain to our patients the need for root coverage, the need for increasing peritoneal gingiva, the need for deepening vestibulum is not so easy. Do you have a special, way or information or a trick? How do you talk to patients?
Difficult question. We know that when we began, we work a lot. And the main indication for root coverage aesthetics, emphasis. But today, no. For me, it's to protect or to improve, to prevent root recession. So we know very well the importance of the keratinized tissue. That And this is for me a dogma, one dogma of periodontics, but sometimes it's important. And other time, no important. But today we know very well, and about research, the importance of periodontal tissue. So
Teeth and implants.
teeth and implant, and mainly in implants. So and we have less than 1 millimeter of thickness, teeth and 2 millimeters high. And that's we need to increase or to change the phenotype, periodontal phenotype.
Yeah.
So it's very important.
I try to say to my patients, like, when we finish implant therapy, I try never to allow a patient to leave my office with no keratinized gingiva. So I try to take that position. Do you think that's too extreme, or?
I think this is true. This is periodontitis. You know, every day we have more and more clinical cases about periodontitis, and of course it's very difficult to treat, and it's more difficult to treat periodontitis than periodontitis.
Mm-hmm.
So if we have keratinized tissue, it's one
More protection.
more protection.
Okay. Okay, my final question is not really dental, but I have noticed you're Brazilian. And when I look at your culture, I've seen many beautiful things, beautiful music, beautiful fashion, beautiful everything. But there's one thing that I have seen also. I've noted a lot of people have tattoos in your country. Do you have any tattoos, any special tattoos?
That's some stuff. But this is forbidden from one of my children just did it. I don't know for why, but maybe fashion for young people in Brazil, for soccer players, something like this. Not in my case. It's not for fashion, and I'm not a soccer player.
And you live in Rio de Janeiro, right?
Yes, right.
If we want to visit you, what do you think is the best season of the year? When should we come to visit you?
So it's close to Carnival.
Close to Garland. That makes sense.
February or March, as in summer, very January, February, March, summer, and close to Carnival.
Okay. Sergio, it's really a big honor and big pleasure to have you here at our GIDE Institute and at the annual symposium. Because thank you, because I know that you don't have the white cologne in Brazil. We're going to give you like a box of sutures, and please come back and visit us many more times. And I want to come and visit you in Brazil as well. Thank you.
Thank you so much. Thank you.
Thank you.